we think about how to be not just trauma-informed, but also trauma-responsive, it's important that we think about actually changing our practice based on this new knowledge that we have around how trauma affects behavior and how trauma is going to affect outcomes for survivors.
Many healthcare providers have likely heard of trauma-informed care, but trauma and violence-informed care really takes that a step further. So trauma and violence-informed care really expands upon the commonly known trauma-informed care by encouraging the healthcare provider to consider discrimination potentially that the patients have faced, social inequities, structural barriers, and things of that nature. When we unintentionally ask why questions or victim-blaming questions, we're further isolating these patients, and then we're missing out on these really important opportunities to connect with our patients, help our patients, create a great medical plan, make sure they're healthy, and of course, make sure they're safe.
Forming a therapeutic, trusting relationship with your patient in medical practice is the most important thing that you can do to identify victims of human trafficking. If you are going in just asking questions, not really paying attention to the answer, not sitting on someone's level, looking them in the eye, treating them as an equal, allowing them to participate in choices in their medical care, they're not going to be willing to disclose anything else that's going on in their life. My experience with human trafficking victims has been at entry points such as the emergency department or labor and delivery or a sexually transmitted infection clinic that is open for the community. I think the most important thing is to approach it from a very non-judgmental perspective and be sure that you don't have anything in the office that could be triggering for a victim in any way. Make sure that every population is represented. Where I work is a LGBTQ Center of Excellence, so we certainly are very careful with our pronouns and have different people represented in all of our posters. You want to create a calming environment so that people are not triggered by loud noises or bright lights.
We need to make sure that the individuals, when they leave the healthcare system, have a safe place to go to, have access to the prescriptions maybe that they've been prescribed, or can return to the healthcare facility because they have a ride to get there. So understanding other systemic barriers that folks may be experiencing, other forms of structural violence outside of just their trafficking experience is vital to their long-term survivorship.
These patients are incredibly vulnerable, which is how they typically get trafficked to begin with. And so we have to make sure that we're a voice for them. So oftentimes, yes, delivering this type of care can take a little bit longer, but it's the right thing to do and it's best practice.